Okay, let's take a look at our female reproduction model. Okay, this is just our small sagittal model from lab. So if we look here from the lateral aspect, not too much we can see. There's not a lot of detail, but we can see the ovary as it sits out here, and then we can see these little finger-like projections that stick off the fallopian tube. Those are referred to as fimbriae. So the fimbriae and the ovary don't touch. The fimbriae kind of surround the ovary and almost vacuum the egg in after ovulation. We'll talk about that in lecture. As we come proximal to the fimbriae, we get into the ampulla of the fallopian tube, and then the fallopian tube ultimately is going to come in here and work its way into the uterus. Okay? Taking a look at the uterus, the part of the uterus that sits superior to the fallopian tube, we refer to that as the fundus. The bulk of the uterus then is the body, and then where the uterus ends up coming out and merging with the vagina, we refer to that as the cervix. Okay? So orienting from this medial view, we have anterior to your right. This blue is the pubic symphysis. Okay? So my cavities are posterior to the pubic symphysis. I have the urinary bladder. Then I've got the vagina, and then back here I've got the rectum. Okay? And of course the rectum opens into the anus. You have your internal and external anal sphincters there. Go back to the front. Anterior to the pubic symphysis, we have all this adipose tissue. That adipose tissue all makes up the mons pubis. Okay? This little blue boomerang-shaped thing on this model here, that's the clitoris. And then again, posterior to that, we have the urethral opening. So the urinary bladder drains via the urethra. Posterior to the urethra is the opening to the vagina. Okay? And as I said, the vagina merges or leads to the cervix, which is the most inferior aspect of the uterus. Now, although the vagina seems to stop at the cervix, there is a space that lies behind the cervix. Actually, it surrounds the cervix. The entire space is referred to as the fornix, but in this view, you can see here the posterior fornix, and you can see the anterior fornix. The opening of the cervix that's found by looking inside the interior of the vagina is referred to as the external os. Okay, OS, the external os. And then once I go through the external os, I'm in the cervical canal, and then the cervical canal opens into the uterus at the internal os, which on this model is not very easy to see. Okay, and again, then posterior to the vagina, you have the rectum with your transverse fold, and then your anus with external sphincters on either side, internal and external sphincters. Okay, so that's our whole female reproductive model: rectum, anus, vagina, posterior and anterior fornix, external os in the cervical canal. This area is your cervix. This area is your body. This area up here is your fundus. The urinary bladder with the urethra, the clitoris, pubic symphysis, mons pubis, and then from this angle I can see the ovary, the fimbriae, and the uterine or fallopian tube. And there's female reproduction.